Hello, I'm Dr. David Nelson, Senior Vice President for Health Affairs for the University of Florida and President of UF Health. The University of Florida and UF Health have been developing plans to gradually reopen our campuses to our faculty, staff, students, and visitors in the coming weeks and months. I'd like to share with you today a little bit about the steps we are beginning to take to do that as safely and carefully as possible, using science, data, and public health principles to guide us as we go. As the governor recently announced, officials are beginning a phased approach to reopening the state over time. To help this effort at the university, our health campuses, and surrounding communities, we plan to introduce a program we call UF Health Test and Trace. This effort brings together physicians, epidemiologists, and other healthcare experts. The goal is simple. New COVID-19 infections can be controlled and reduced to manageable levels by expanding testing initiatives to test everyone, quickly isolating those who are infected or who have been exposed to someone who is positive. We'll be essentially setting up a public health disease surveillance unit operating in collaboration with and under the authority of the State Department of Health. Contact tracing is a concept as old as the study of infectious disease. It involves some basic detective work and time-tested principles of the field of epidemiology. Students, faculty, or staff who test positive for coronavirus will be interviewed by UF Health public health experts who will identify as many of the recent contacts as possible. Maybe roommates, boyfriends, girlfriends, acquaintances, the mechanic who fixed their car, a landlord who collected the rent, and so on and so on. One study shows that if only 20% or more of the contacts of a symptomatic person are traced and put into quarantine, then an epidemic can be controlled, and we can prevent this dreaded second wave we've heard about. Our goal is to provide test results quickly, within 12 hours or less, for those that are conducted and processed at UF Health. Test and trace won't prevent all cases of COVID-19 on campus. That's impossible. But it will slow the spread and allow us to protect the most vulnerable, those who are at greatest risk of severe illness if they become infected. It will also help prevent the hospital and healthcare system from becoming overwhelmed. The overall mission here is to create the healthiest, safest environment possible for everyone and build your confidence in returning to campus so we can all get back to learning, teaching, and discovering. Reopening our campus does not mean a return to normal. We will go slowly with easing social distancing and watch the trajectory of the epidemic. We will reopen campus using a thoughtful, coordinated, and phased approach, which you will soon hear much more about. Our plan is to loosen the faucet rather than open the floodgates. As we take these important steps forward, we will continue to enforce ongoing public health measures like frequent hand washing, covering your cough, using hand sanitizer, and following other sanitization and social distancing measures that we have all grown so familiar with. UF Health Test and Trace is novel and unique. We anticipate that others around the country will implement similar models based on our approach, and we stand ready to provide data and guidance to our colleagues across Florida and across America. Thank you for your cooperation, patience, and resilience. As we look back on these unprecedented times, we will see just how strong and determined Gators are, and I thank you.